Wonderful. Welcome back to the channel, Boulder Pain Relief Massage here in Boulder, Colorado. This is Loud Kemper, answering some wonderful and frequent questions that I hear from my clients and patients. And today is another one regarding the jaw. A lot of us have issues in this area and we don't often know what to do about that. And so here's a wonderful question that I get a lot. I have a lot of questions generally regarding what do I do with sleep positioning, pillows, why do I have pain when I wake up? And so this question and discussion is largely about why do I have pain in my jaw when I wake up? So I'm a massage therapist. I do not diagnose, but here are some common considerations that involve the soft tissue of the muscles of the jaw that primarily close the jaw here and then open the jaw here, which you can feel on yourself a little bit if you place your hands around your face and your jaw and just give a little motion. You might feel some changes there in the tissue. And so a couple things. Why does my jaw hurt when I wake up? So a lot of people clench. Clinically, we're talking about a condition called bruxism, where people clench and grind their teeth. And if you've had a dentist notice this, if you're having wear patterns in your teeth, you'll sometimes be prescribed a night guard to minimize the wear. Now, night guards are phenomenal at preventing damage to the teeth and the enamel of the tooth themselves and the teeth themselves, but they often give a lot of permission to the muscles of the jaw to just clamp down more. And so one of the things to consider is if you're having jaw tension. I mention this in most cases when I work on the jaw in TMJD related cases. The woman who taught me these techniques, this is on my website as well, Mary Atkinson out of Washington. She's a TMJD specialist, and she would often remind all of us students, lips together, teeth apart. If your teeth are ever touching during the day and you are not chewing food, that's a simple way of thinking that your muscles of your jaw are working too hard. They're clamping down when they do not need to be used. And what I like to tell people is that the patterns of the day inform the patterns of the night. So if we're training our jaw to hold a lot of tension and bracing, and we're feeling some stress in general, then it's not uncommon that we're going to feel some clenching and bracing patterns in our jaw while we're sleeping. A lot of us are holding quite a lot of load in there. So that's one, noticing what can we do to change the patterns of our jaw while we're awake so that we give ourselves the best shot to minimize pain at night. Now here's another consideration which is really interesting. A lot of people think about, what should I have as far as a pillow, etc. And I mentioned earlier I have these questions. And one interesting thing is the mandible is a piece. It's a single bone. And so this can translate left and right. It can move. It can be displaced a little bit. And one of the things I look for is what's called mandible deviation. When the jaw opens and closes, is it tracking really nicely up and down along the center line of the face, or is it biasing one direction as we open and close? And so if you, like a lot of people, are a side sleeper, and it's comfortable for a lot of us, just paying attention to how you're loading your face on that pillow. If you have a tendency where you're just resting on the jaw, and I'll give an exaggeration here, is if I'm resting on my side and I'm actually creating pressure on my jawbone, my mandible, rather than uniform pressure on my whole head. If I'm creating pressure on here, if I exaggerate this, my jaw can shear. We can move our jaws to either side. Chewing is not just this straight up and down action, but its mastication is actually kind of grinding down this food. So there's a lot of movement in the jaw. And if we're sleeping in a certain position for a long time, plane travel can do this as well. It can actually cause an imbalance in the jaw tissue. You can see here, if I exaggerate on my own face here, we've got a little bit more length here, a lot more, and then shortening over here. And so those are a couple considerations as far as why we can have jaw pain after sleeping. Our position, if we're clenching and grinding while we're sleeping, these are a couple ways to start thinking about how to reduce pain after sleeping, if it's a common pattern for you. So I hope this helps. Please like and subscribe to the channel. And if you have any questions, please drop them in the comments so I can get to them for my next videos. Thanks so much.